We go. So are your kids not sleeping well? Well, I've brought in Samantha Day from Samantha Day Consulting. She's an expert in helping families learn to teach their kids to sleep well, to go to sleep easily, and to go to sleep happily and not have it be such a struggle, because sleep is everything. And next week, I'll be doing a very special event about airway and how that relates to sleep. But you know what else? All of this relates to what I do, which is help picky eaters. So we're going to get into that tonight. I know we have a lot of speech language pathologists and parents joining us, occupational therapists, and some other sleep experts as well that are also following Samantha's work. So where we're going to start tonight is I'm going to just tell you that I have been following Samantha on Instagram, and she and I got to know each other that way, just some messages and chatting a little bit back and forth. And I was really, really, really impressed with her approach because it's a little serendipitous. She has a background in special education. So, Sam, will you introduce yourself and tell everybody about that background?
Yes, absolutely. Thank you so much for having me. I love to share this information and I love how our backgrounds connect. So, a little bit about me is I'm a certified sleep consultant for infants, children, and the oldest child I've worked with to date is 12 years old. And I'm also a behavior specialist, but that actually stems to my background as a special education teacher. So, that's what I knew I wanted to be. I always partnered and worked with families who had children on the autism spectrum, and that was my heart. It will always be a very big piece of my heart. And then I became a mom. And when my son was born, he was not a good sleeper. And I definitely am a mama or a person that needs a little extra sleep than maybe the normal adult does. I really love my sleep. And, it's normal. We're used to when our babies are born, segmented sleep is normal. But his lasted longer than what was healthy for me. And more importantly, what was healthy for him. And so it was at that point that I decided, okay, we need to do something to get him sleeping a lot better. And so I actually use some of my behavioral background because sleep really is a learned behavior. A lot of people think that kiddos just are born and they either are good sleepers or bad sleepers, and that's just the hand that you're dealt. But it really is a learned behavior. So I guided him in a consistent way using my behavioral background, and it worked, and he did really great, and he was getting the solid sleep that he needed. And at that point, friends were saying, "What are you doing? I need some help." And so I would help them out, and their kids started sleeping, and just kind of snowballed from there, where eventually one day I said, I love to help people. That's what I've always loved to do. And my husband actually said, "You love this a lot. Why don't you go back to school and see if this could be a thing?" So at that point, long story short, I went back to school and was certified specifically in sleep. And it's been almost 6 years now of helping families. And I absolutely love it.
I love that. That's one of the reasons I was so interested in your Instagram page and just getting to know you a little bit better, because I also have a background in behavior, and I'm often known as a behavioral feeding therapist, but I don't like that term because it makes it sound like the kids are being naughty. People always think behavior refers to naughty behavior, but the reality is we're all doing a behavior at this very second,
Yes.
maybe five per second. And I think when you really begin to understand a child's behavior, what you're beginning to do is know how to observe and identify what's influencing the behavior. And I know one of the things you often talk about is the sleep environment and how that influences a child's behavior. So share that with everyone, please, if you don't mind.
Yeah, absolutely. Yes, every behavior serves a purpose. So figuring that out and what's fueling this behavior, what's stemming this is really, really helpful. But environment is a really great way to communicate with our little ones and really guide them in a proactive way
Mhm.
to solid sleep. And so it depends on the age of your child. The recommendations change a little bit. But when our children are first born, we really want the environment to communicate sleep at nighttime, because a lot of babies are born with day and night confusion. And so they'll sleep a lot during the day and then they'll be up way more than normal at nighttime. And we want to get that on a natural pattern, even though we are expecting segmented sleep for a baby. We really do want nighttime to become the stronger and longer portion, and then daytime to be more nap involved. So when a baby's first born, through about the first 3 months, we want nighttime to be dark and quiet, and use a sound machine if you'd like to, and a consistent, white noise to communicate that it really is time for sleep. We like to limit our communication and our eye contact and things like that at nighttime. And then during the day, if they happen to be sleeping in a bright environment, that's okay. If there happens to be noises going on around them and people are talking, or if we ever get to go to restaurants again, we go to a restaurant and we have dinner and they're sleeping somewhere while we're eating. Those types of things are typically okay to have a big difference between daytime environment and nighttime environment. But once we hit about 4 months old and older, a lot of people will say, well, my baby can sleep anywhere, or my toddler can sleep anywhere. And there are a lot of kiddos who can fall asleep in a stimulating environment or a light environment. But just because their eyes close doesn't mean that it's a deep restorative level of sleep that we're looking for. And sometimes it happens, they fall asleep in the middle of a party or something like that. No big deal. But for the average 4-month-old all the way through childhood, if we can make those naps take place in a dark environment that's nice and quiet, we have a stronger chance for a more restorative nap, because sunlight actually has the power to suppress our production of melatonin. So if our babies or our toddlers are sleeping with, the sun just blaring in their room, they may close their eyes. They may even sleep for an hour, hour and a half, but chances are they're not producing as much melatonin during that time, and that might lead to some shorter naps. So through the environment, we want to make it nice and dark for naps after the 4-month mark. And then a consistent white noise is really important too, because it becomes an auditory cue that it's time for sleep. And sometimes we can connect that auditory signal. It stays on all night long, and then we turn it off in the morning before we even start our morning or take them out of the crib or the bed. And that disconnects that auditory signal and really helps the brain to understand what the environment is communicating before you even talk about how you're going to teach them to fall asleep.
I love that. It really makes me think about being a speech language pathologist myself and working very closely with occupational therapists and learning, as you did too, as in special ed, that you really begin to learn about how children learn to shut down when they're overstimulated. And so often when parents will say to me, my baby can kind of sleep anywhere, like it's almost wild how they'll just fall asleep like in the middle of this really stimulating concert. Sometimes that's because they're so overstimulated.
Yes.
And if they're going into that, I need to shut myself down state, it isn't necessarily, correct me if I'm wrong, because they're having that restful sleep. It's because they're retreating into themselves.
Yes.
And I just love what you've said about pairing a specific sound or a blankie, whatever it happens to be, that helps everyone understand. And now it's time to rest and sleep, not to shut down and retreat.
Yes, absolutely. That is so important for them to understand that this is a safe time, that we're closing our eyes, that we're getting that depth of sleep we're looking for, and not just a way of shutting down and escaping essentially in that moment. Yes, absolutely.
And I didn't tell you that I was going to ask you this, but you just got my brain racing here. So me working with hesitant eaters, picky eaters, what about that relationship between where the parents are like, I'm so worried that if he doesn't get something to eat right before dinner, that he won't sleep well. But for me, the opposite is also true, which is if he doesn't sleep well, he's not going to eat well. And do you have any thoughts around that?
Yes, absolutely. And I would say that is where the biggest controversy falls as far as how much they need to eat versus how much they need to sleep. We always hear, your baby needs to eat this much or your child needs to eat this much. And if they're hungry, they're going to be waking up in the middle of the night to eat. And there's a time period where absolutely our little ones need to eat in the middle of the night, right? That happens, that's expected. But there comes a point in which sleep is equally as important. And we really like to get those calories and that food intake during the day and then get that solid sleep that we're needing overnight. And a lot of times we'll hear or parents say, well, my little one's waking up because they're hungry. And oftentimes if we analyze the situation and I take a deeper look and we just fix a couple little things, we will typically see for about 4 to 6 months and up, not in those early couple of months, if we fix a couple of things, the one of those being learning to fall asleep independently at the start of the night, that one's huge. Right. We will usually see that those night wake ups, eliminate themselves once they have those learned skills, those learned behaviors to be able to sleep all the way through the night. So oftentimes they wake up and then they are wanting milk to go back to sleep, right? They wake up and they want to nurse, or they wake up and they want a bottle to go back to sleep. But if they have those new skills, all so often they don't even need that, and they just start to connect their sleep cycles, and we'll see less and less wake ups overnight. Of course, if they wake up and they are hungry, we want to feed them, but we want to get to actual nutritional need feeds and not the want feeds to go back to sleep once we reach a certain age. That way, our children are getting the solid sleep they need overnight. And then during the day, they're rested enough to be able to be patient, try new things, get the food that they need at the dinner table, and really be able to control their behavior to a level where they can start to eat new things as well, if I'm correct on your end.
Yeah, absolutely. But I'm sitting here nodding because I'm listening and just soaking in everything you're saying. And what I hear you saying is it's kind of about expectations. And our expectations as human beings is based on what we know. And I know when I was a young mom and worried about my kids' sleep and trying to figure out how to help them sleep through the night, et cetera, I was pulling from information from all over, including my own mom, and things have changed a lot.
Yes.
And I had expectations based on my level of knowledge. But what I think you do is you provide additional knowledge based on current research to help parents adjust their expectations and then decide to make the next step. I also know, though, that you're very respectful of a family's values and finding something that works for them and not necessarily saying this is the only way to do it. I know that from talking to you before, but can you just chat a little bit about family values and family expectations and how important that is in this role of helping our kids have a peaceful sleep?
Yes, absolutely. Thank you for giving me the opportunity to talk about this, because I honestly would say that it is one of the most important things to talk about. A lot of people hear the three words, which are cry it out.
Mm-hmm.
Okay. And those three words make them go, I can't teach my child how to sleep because I will never do cry it out. It is not for me. I don't agree with it. It's not going to happen. And for a lot of families, that's the case. I never personally did cry it out with my kiddos either, and they're great sleepers. And but for some families, they do, that cry it out is the method for them. And so it's really a matter of realizing that my family is different than your family. My child is different than your child, and our parenting styles are probably different as well. But what is the same is that every single one of us needs sleep. It's not that, oh, I got a bad sleeper, or, my baby just doesn't need as much sleep as your baby does. There's a lot of comparison, a lot of social media things that say #tired as a mother, right? And we start to think, well, this is just how it's supposed to be. My child's supposed to wake up in the middle of the night, when really we can teach our little ones in a way that fits our families individually. So I am not pro one method or another. What I am is really passionate about the fact that cry it out does not equal sleep training. A lot of people think that those phrases are interchangeable, and they're definitely not. I call it teaching sleep because, like I said, it's really a learned behavior. So I don't even say sleep training, to be honest. But teaching sleep, the best method to teach sleep is the one that fits your family individual. So you have to find the one that you're comfortable with. Which one sits well in your mommy gut? Which one says, okay, I think I can do it. I think I can teach my child these skills that they need for their growth, their health, their development, their behavior. I can teach them these skills using this consistent method. And so it's really a matter of finding that one that makes you go, okay. Now, we always have to get a little bit uncomfortable before we get comfortable, right? As we teach our child a new skill, like as you're putting new foods on their plate, we might be a little bit anxious about that too. Oh, are they going to eat it? Are they going to touch it? What's going to happen? We feel sometimes anxious when we're presenting something new. Same thing happens with sleep. As we decide, okay, tonight's the night we're going to work on these new skills, we're going to feel a little bit anxious, but finding one that you feel like you can be consistent with is so important. There are, I would say, probably 9 or 10 different sleep teaching methods that I really love, but the best one is the one that fits your family.
That makes me so happy that you're saying that. And we have a lot of people on here who tune in every Monday night. I can see their names going by. And they've been to my courses or have been following me. And they know I say the same thing at the beginning of every course, which is this is not the end all be all way of doing it. You know, this is what works for me, Melanie Potock, the most. I don't do it with every kid, but this is kind of my go-to method. That doesn't mean I don't go to every possible course I can, because every child is different, every family is different, but also every teacher, every therapist is different. And you've got to figure out what's going to work according to that family's values that you're trying to help, but also for your own values. And the more we learn, the more we know, the better we'll do. So you and I are so on the same page around that.
Good.
We're going to have some questions here in a few minutes, but I have to confess, I have been having a hard time sleeping. So help me. But I've been having a hard time sleeping just with the pandemic, and I've just, having to change so many things in my life, and my brain is racing, and I'm going back to some old strategies I used to use, and I'm going to be fine. But the reason why I'm sharing that is I know as an adult that when I am overtired, or when I've been in front of the computer too long, like Monday nights, I usually don't sleep well because I've got all this going on in the evening, as much as I love it. And if I don't practice my sound sleep habits and a nice nighttime routine, I'm often up for 2 to 4 hours in the middle of the night. And I'm okay, but I know it's not healthy. And I also know that I'm kind of cranky and a little more teary than I normally would. Because frankly, right now things are hard, and I know everybody's going through it. I'm just saying that I know that little bit of a loss of sleep, and I'm a grown-up. Like, I can cognitively manage all this and figure out what to do. I think about how that affects me as an adult. And then I think about the little ones that you're helping and how really important it is that they get very, very good sleep. Yeah. So is there anything else you can tell us? I know you have a lot of information on your website, and we're going to share that with everyone in just a second. But are there any other tips besides just that element of being overtired? But what else can you share with us?
Yeah, so that overtired thing, you hit the nail on the head, because you and I as adults, and the adults that are watching, when we're overtired, it is harder for us to sleep, and it's harder sometimes for us to fall asleep and things like that. But when we're overtired, we often look tired. Our body kind of, looks like it's ready to sleep, even if we can't quite doze off yet. But our little ones, when they are overtired, our babies, toddlers, and children, oftentimes it looks like a second wind. It looks like they are wide awake. There's no way they're falling asleep anytime soon. And oftentimes it's because an overtired level will spike up their cortisol levels, that stress hormone that we produce. And it does make them feel like they have a second wind. But along with those heightened cortisol levels, it often leads to a harder time falling asleep, additional night waking. Sometimes we'll see 2 to 5 times in the middle of the night that a toddler is waking up in the middle of the night because bedtime is too late, or because, they didn't nap at all throughout the day, depending on their age. There's multiple different factors that can connect to an overtired level, but that heightened cortisol is something we really want to avoid. So one of the best things we can do is we want to look at our child's individual age, look at how much sleep they should be getting overnight, and how much nap sleep they should be getting. Okay. And then the more important part is how much time can they be awake without reaching that overtired level. And so I actually have a free download on my website. People can go there and they can download this chart, and it's connected to my Instagram as well. And it'll show them the age of their child, the total sleep, and their awake time window. And when we follow that, when we have about the same amount of time of windows of being awake, without having really, really long stretches, then we know that our children are going to sleep at the right level of tired. We're avoiding that overtired level, making it easier for them to fall asleep and easier for them to stay asleep. And again, before you even start teaching sleep, that can help them reach that solid sleep and connect those sleep cycles that we were talking about.
So this free download, it's a chart to help you keep track of that and know how to shift things accordingly?
Yeah, it says different ages, total night sleep, and total nap sleep, and they'll be able to walk through that.
Well, I'm going to look through for questions here in one second, but tell everybody about some of the other things you have on your website. And I know we're
Mhm.
doing a giveaway as well. So if you'll chat with everybody about that, I'll scan these questions and pop a question on the screen
Sounds
because we are
great.
getting
I
a
love it.
lot of them.
So the giveaway I'm excited about, guys, is whoever wins gets to choose one of my children's books. I have two of them. Sleepy Susie is a little girl who loves sleep and models good sleep habits. And then Sleepy Steve is the exact same book, but in a boy version. Okay, and they're modeled after my kiddos. The illustrator drew them to look like my kiddos. But what it does is it really models healthy sleep habits, because unfortunately there's a lot of children's books out there about sleep that talk about the monsters under the bed, or being afraid of the dark, or not wanting to go to sleep and telling mommy and daddy no. And we really want to avoid reading books that model that type of behavior around sleep time, but most of them have it. In fact, I read a book the other day that referred to the crib as jail. And so we really just want to do our best to avoid books that do that. And then just any type of book that models good behavior, like, your book, because I love your book, Melanie.
You are not an otter.
Yes. Oh, it's one
You
of my
read that to
favorites.
your kids the other night. You were so cute. You put on your stories. I loved it.
Yes, we absolutely love that book. So that's one of the options. But on my website, there's a lot of different things, because, like we talked about, finding the sleep teaching method that fits your family is what's most important. So a lot of sleep books, sleep training books, and a lot of consultants will focus on their one method, which is totally fine. But you may have to sort through a couple of them to find the one that fits you. So what I try to do on the website is find each one of the series, their immediate assistance videos that will walk you through creating the plan that fits your family. So there's one for infants, which goes up through 3 months. There's one for 4 months all the way to 5 years old. And then there's one specifically for toddlers, but it will walk you through creating a plan so that the minute you start, you have an individualized plan that fits your goals, your child, and your parenting style, out of a lot of different choices that are on there, without having to read, 5 different books or
Right.
research 5 different consultants. You have all of it there. You create your plan with my help.
I like that. There's answers and you can implement them right away. That's fabulous. That's what parents want.
Thank you.
Becky has a good question for us. It's a little bit long, so it may not all appear here, but I'll read it out loud. Becky asks, one of the parents I work with is asking if her kids don't fall asleep at bedtime and stay up late, should she let them sleep in to get the sleep or wake them up at the normal time? That's a great question. Is it better to get the sleep and throw off the sleep schedule, or wake them up and have a grumpy day?
Yeah. That's a really good question. So it really depends on the family and if the child is getting the right amount of sleep. So a couple different examples. Let's say in this situation we have a 4-year-old, because we don't know how old this child is. So let's say they're 4. We're looking for 11 to 12 hours of overnight sleep for this 4-year-old. So if this 4-year-old is able to go to sleep at 10 o'clock at night and sleep till 9 or 10 o'clock in the morning, and it works for the family, the mom and dad don't mind, then there's nothing wrong with that at all. And I would just stay on that schedule. But if mom and dad would really like a couple hours by themselves before they go to bed, there's nothing wrong with waking them up in the morning and trying to get them to sleep at, let's say, 7 or 8 o'clock at night, waking up at 7 or 8 o'clock in the morning. And that might take a couple days of waking them up in the morning. But here's the most important thing. Most kids, babies and toddlers, if they go to bed later, they're not going to sleep their normal amount. The later they go to bed, they still either wake up earlier in the morning or at the exact same time. So a late bedtime typically automatically leads to less sleep overnight, because they're still up at the same time.
We see that when the clocks change.
Yes.
The parents are like, oh, they'll just sleep. No, nope. Nope, nope, nope. They get up and you're like, but I'm so tired. Yeah, they have a hard time adjusting. Great answer. We've got some other questions along that line too. Elisa is asking, my 5-year-old son still body rocks himself to sleep and again in the morning. What can I do to help him reduce this? Thank you.
Yeah. So oftentimes we find a way that calms ourselves to sleep, right? And so for some kids, it's really simple. Maybe it's a quick little head, rock back and forth. For other kids, they're rubbing a blankie they might have. I'll say that I kick my foot sometimes as I'm falling asleep. We all find that there is an actual like rhythmic sleep situation that some kids will do to calm themselves. And if it's something that they rock themselves, they're not hurting themselves, I wouldn't be too concerned about it. And if it's their way of calming themselves, I would just go ahead and allow that. But if it's something where they're body rocking and like hitting themselves into, the edge of the bed, or they're leaving bruises, which sometimes happens, then we want to kind of address it at that time. And one of the most common reasons to see additional body rocking is at an overtired level. So I would actually analyze it proactively and say, could this be happening because maybe bedtime's too late, or maybe we have a nap in there and we need to eliminate the nap? I mean, there's a couple different reasons that it could proactively be happening.
Great answer. Jen has a question here. Again, it's a little bit longer, so I'll read the whole thing for you. Hello from Northern Virginia. Hi, Jen. My 4.5-year-old hasn't slept independently since we transitioned him out of a crib a year and a half ago. He now has a 10-month-old brother, and our biggest struggles are getting the 4.5-year-old to stay in his bed all night. He climbs in with us or wants one of us with him, and getting both of our boys to sleep past 6 a.m. We're all exhausted.
Yeah.
So 2 issues really there.
Yeah. Well, Jen, thank you, and hugs to you, because I know this is really hard. But I will say that what we want to do is come up with a way to guide your 4.5-year-old to feeling safe and secure in his own room. We really want him to know that that's a safe space, that it's okay to, if he wakes up in the middle of the night, what do I do to put myself back to sleep? And really start talking about that during the day, and, telling him, practicing with him, even during play. You may have a stuffed animal and you say, okay, let's squeeze our hands tight and count to 10 together, and say, if you wake up in the middle of the night tonight, let's do that, and practice some of those emotions and calming strategies proactively is one of the things that we would do. But ultimately, we want to come up with a plan of how are we going to respond to him when he wakes up and joins in your bed or walks to your room. And however you choose, whatever sleep teaching method you choose, we have to do it consistently no matter what. Because if the option to come in your bed is there, it will win over any way that you're trying to guide him. So we want to choose a way, create a plan of like, okay, this is what I'm going to do when my little one comes to me in my room. I'm going to guide him back, or I'm going to, go to his room, whatever you choose. And then we want to do that consistently no matter what, so that he sees that even if he raises his behavior, okay, because he's not going to love it the first time you don't let him go in your bed. And even if he raises his level of behavior, your level of response does not raise, okay? Because he's going to keep doing this in hopes that you do this. So we want to just be really, really consistent. And my series, the Nix Those Night Wakings video series, that one has a video specifically about exactly what to do in this situation. And it also would apply for your 10-month-old. So I would check that one out, because that one's 4 months all the way to 5 years old. You could create 2 separate plans with the same videos because it's so individualized, and it would solve both the issues.
But the overall theme is calm, concise, consistent.
Yes.
Okay. Ashley has a question that piggybacks onto that beautifully. She says, is co-sleeping with a child ever not a good option for the child? And what about tips on how to transition a fearful 4-year-old to sleep in their own room without an adult? You've touched on that lightly, but anything else you'd like to say?
Yeah, I want to talk about the first part of it, since the second part's similar to what we just said. But is co-sleeping with a child ever not a good option? And the answer to that is, if they're not getting the right amount of sleep, if co-sleeping is leading to them waking up and wanting to talk to you in the morning, or in the middle of the night, or needing more assistance to go back to sleep every time in between their sleep cycles, or if them sleeping with you wakes you up all night. So if either one of you are not getting the sleep that you need, then potentially co-sleeping maybe isn't the best option. But if you both enjoy it and your child's getting the sleep they need and you're getting the sleep you need, continue to do it. For sure, every family's different, and some people successfully co-sleep and love it. But if it's disrupting your child's sleep or your sleep, then we want to analyze something to get you guys the solid sleep that you need.
Because working on your child's sleep has as much to do with getting better sleep as an adult too, so that you can parent them the way you really want to, and you're not tired and not worried about your own health, because we know sleep is so important to good health, and we all want to be really, really aware of that, especially right now. Jennifer has a question that is also a great one on that theme, which is, she wants to know, are you going to address night terrors, bad dreams, and sleep disordered breathing? And I'm just going to respond, if you don't mind. And Sam, let me know if you've got something to add. Jennifer, next week I'm having a certified oral-facial myologist, my friend Ann Venables, join me, and we are actually going to have one of our mutual clients join us as well, who's had some sleep disordered breathing. And we're going to be talking about, just like tonight, we're talking about sleep is everything. Next week, we're talking about airway is everything. And when it comes to getting good oxygen in the body, it's really important that we're aware of those subtle signs that your child may not be getting enough oxygen. And if they're not getting enough oxygen, they are not sleeping well either. So we're going to be covering a little bit of that next week, Jennifer. But Sam, is there anything you want to tie into that?
I think that that's perfect because, yes, those are things that are definitely something I would refer to a doctor in that situation, or someone with a specialty in a different area. So I don't talk about those specifically. The one thing I do work on out of those is night terrors, but there are a lot of different causes of night terrors. The most common one, I would venture to say 90% of the cases that I've worked with personally with night terrors have been connected to a child who's going to bed too late or who is at a consistent overtired level. And typically when we fix that, we stop seeing those. My daughter actually had night terrors. She was one that was caused by other issues, but if she had a late night sleep, she would have one that night. If we, were out at a party or something, late night fireworks on 4th of July, I could almost guarantee there would be a night terror that night, where if she went to bed on time, we would not see one. So that's just a simple example on why we sometimes see them.
I also think that's a great example of creating a good team around your child, because you've brought up a great example of a little kiddo that you were able to problem solve it, and that's awesome. That's why I would refer to you. But from my standpoint, I'm going to look at it in a different way, and neither one's wrong. It's that they're both right. Yeah. And that I'm thinking about this one child that we're going to be talking about next week, and suffering from night terrors, and how it was related to large tonsils, large adenoid tissue, and just not being able to get enough oxygen. And we have some good research now that shows that those two are closely related. But that doesn't mean the children that you're working with have large tonsils, large adenoids. Like, it takes some good detective work to really figure out what's going on with that particular child. So I'm excited to share more information on that next week as well. I'm going to grab one or two more questions, and we want to let everybody know that when we're all done here and say goodnight, Samantha will be going on and choosing the winner. So thank you so much for all your questions. If we can't get to them tonight, we'll both go on by sometime tomorrow, and we'll type in some answers for you as well, because they are just streaming by me so fast. Bear with me, everybody. This is an interesting one. I'd really love your thoughts on this, Samantha. What are your thoughts on the use of melatonin? I have many pediatricians to jump to suggest melatonin for kids who don't sleep through the night.
Yeah. Well, I'm going to be open and honest about my thoughts on that as well. I would agree that oftentimes there is a jump to suggest melatonin. And in my experience with the families I've worked with, oftentimes pediatricians, who are wonderful pediatricians, they don't necessarily have the time to walk through all the necessary steps to get our children sleeping, right? In a 15 or 20-minute appointment at the pediatrician, it's very difficult, where I work with a family for an hour to an hour and a half, if I'm working with them one-on-one, to go through every single step. So oftentimes I'll say, well, try this, do this, and then you can always try melatonin. And there are absolutely children who need a little boost in melatonin, and that is something that is helpful. But there are also a lot of children who don't need additional melatonin. They take it, but it doesn't change anything, because we're needing to look at it from a behavioral side or from a teaching side. If most of the time it's teaching them to fall asleep independently at bedtime. That is one of the most important needed things. So then even if our kiddos take melatonin, we still do not see a change in sleep. So it's very common for a family to come to me and say, we're on this much melatonin. We've been doing it for 6 months. We've seen no difference, but we keep doing it because our pediatrician said to try it. We're going to give them more. And I say, hang on a second. Let's work on a few things. And then at that point, if you don't see it, then revisit with the doctor. And most of the time, by addressing some of those things, we are able to take away that melatonin in more cases than not.
And sometimes it's just a matter of combining the two in the right balance. But you can't ignore the behavioral piece and setting that that bedtime environment that you talked about earlier, and setting expectations too, and that this does take time. Unfortunately, I feel like sometimes when we think about taking a pill, we think it's going to be an instant fix. And even with melatonin, it's not. I know my co-author, Dr. Namali Fernando, who's a pediatrician, her patients call her Dr. Yum. She wrote Raising a Healthy, Happy Eater with me. And one of the things we mention in there is she will often recommend dark cherry juice, but definitely the whole dark cherry juice, nothing, no sugar, nothing added to it, and or some almonds if the kid, or chopped up if the child is under the age of 3, 4, because those have melatonin in them. But we also recommend that behavioral piece, that's setting the expectations, that's setting the environment so that it is conducive to sleep. And this is what we do as a family. This is our standard bedtime routine. So just like a bedtime snack that's small, that's part of the routine, it could also be that that little bit of extra melatonin is more of a placebo for the parent. Just like we often think of a warm glass of milk as helping kids sleep, we don't actually have good research around that, but often the kids do sleep better. And I think it might be because the parents sleep better and don't wake as easily, worried about the kids not sleeping better. Who knows? I think we need more information on that. But I just want to circle back and say it does take, again, some detective work, and it's not as simple as just taking melatonin for a lot of these kids. Not to say it's good or bad, but just there's more to it. So I'm so glad that Lisa asked that question. I'm going to grab one more question for us. Let's see. Oh my gosh, so many people are saying this is so great, and so many new moms on here. Oh, you know what? Cicely has a good question, and Cicely, I apologize because she often is here on our Monday night with Coach Mel Facebook Live. She always has good questions. I apologize because I missed your earlier question, but she's saying, how do I get her to stay asleep? And I think just in general, would you mind sharing with everybody a few points on how to get kids to stay asleep during the night? Because it's usually during the night that's the bigger issue.
For sure. So the most important thing, which we've talked about a little bit, is making sure that they know how to fall asleep at the start of the night. If they're assisted to sleep, laying or cuddling with mom or dad, or rocking, nursing, bottle, any of those different ways that we assist them to sleep, or even falling asleep in mom and dad's bed and transferring them to theirs, right? If the environment or the situation is different when they fall asleep than it is when they naturally wake up between sleep cycles in the middle of the night. We all go from cycle to cycle to cycle and naturally wake up sometimes in between them. If the environment or situation is different, when they wake up in the middle of the night, they are going to call out for you to recreate that situation or some other type of assistance to go back to sleep. The easiest time of the entire 24 hours of a day to learn to fall asleep independently is at bedtime. So if we really start working on that skill at bedtime and reinforcing, consistently teaching them at that time, then when they start waking up in the middle of the night, they can hopefully start utilizing those skills to go back to sleep. And then eventually they'll mend those sleep cycles and they will start to see less night wakings. So that's one of the things, teaching them to fall asleep independently. Also making sure that when they're sleeping, it's the right time. So their bedtime is not too early or too late, depending on their age. They're taking the right amount of naps and they're not, too little amount of sleep or too much sleep.
Yeah.
We're just kind of making sure that when they're sleeping, it's the right amount of time and they're not too overtired by the time they fall asleep. One of the biggest things that connects to night wakings is a late bedtime. So a lot of times we'll see babies go to bed or toddlers at 9 o'clock, 10 o'clock at night, and that will connect to night wakings. And sometimes when we pull that bedtime earlier and it's more like 7 to 8 o'clock at night, we'll see 1 or 2 of those night wakings fade. So we definitely want to look at those few pieces of the puzzles, but check out the Nix Those Night Wakings video series because that's exactly what it was created for.
And you work with a lot of different ages, but I imagine things change the sooner we address the sleep issues. But on the other hand, is it ever too late, or what do you run into in your practice?
It is never too late. The oldest child I've worked with is 12 years old who had never slept through the night, and we got her sleeping well. That was more of a behavioral and an anxiety side. But there's, a ton of different reasons. So it's never, never too late. It's always equally as important. But yeah, the earlier that we work on it, the easier they may be able to learn those skills. And then as they naturally hit the different bumps in the road, right? They transition naps, or they, new sibling comes, or they are teething, or they're sick. All these different things that can put a bump in the road when it comes to sleep. Think about us again as adults. When we don't feel right, when something's going on, or when we're sick, how amazing would it be to be able to just go take a nap, right? Moms don't get to nap often, but
Right.
if we were able to, it would be amazing because we know how to sleep. So when we don't feel good, we want to sleep more. And when our children have a good foundation to sleep under them, and they don't feel well, or they're going through a transition or something, usually we will see them sleep more instead of less. So oftentimes people say, well, my baby's sleeping, or my baby's teething, so they're not sleeping, they're up all night long. But a lot of the times, kiddos who have a good foundation, sometimes we don't even know that the teething's happening because they're not feeling well, they tend to sleep a little bit extra. That's just one example, but we can really work on that and have that good solid foundation as soon as you're able. Usually I'll say around 4 to 5 months old is when we can really start teaching sleep.
Wow, this has been so helpful.
Yeah.
I can just tell by the comments going by that people are just soaking this in and loving it. And I'm really grateful that you're taking the time with me to do this. And it's got me thinking more about the kids that I'm working with and how to suggest a few of these tips, but also how to refer them to you.
Well, thank you.
Because as I said at the very beginning of this broadcast, this seems to be a big issue for everyone. And I know it's a big change in routine. It's added stress. And I think a lot of that can kind of snowball and create a bigger problem. So the sooner that they seek help, the better, and everyone will be having a good night's sleep. So Sam, thank you so much for joining me. And thank you to everybody who joined us tonight. This is such a big group who tuned in. I look forward to having everybody join me next week when we talk about airway and how that's related to eating and sleeping and overall health. And just speaking of health, everybody stay well and take care of your families. And Sam, I'm going to say goodbye, but thank you again for being my very special guest today.
Thank you for having me.
Bye, everybody. Thank you so much.